You brush twice a day? Maybe even flossing still? Your teeth are yellow? Here's what no one tells you. Today we uncover the real reasons behind yellow teeth that go beyond just brushing, and how to fix them. Welcome back, everyone. This is King Gideon Mindscope. Let's dive right in. Number 1. Enamel thinning. Brushing cannot bring enamel back. The American Dental Association recommends a soft bristle toothbrush and gentle brushing technique. But even with the gentlest touch, enamel doesn't regenerate. That's why as enamel thins, the yellow dentin underneath shows through. Think of it like the paint on an old car. No matter how much you wax it, that yellow primer will eventually peek through. When enamel wears down, you get exposed dentin. Acid erosion is one reason for enamel loss, which we'll discuss more later. Aggressive brushing over time can also cause enamel thinning. That's why it's crucial to use a soft, bristled toothbrush and practice a gentle brushing motion. But don't worry, you don't need to brush as gently as your grandma's china. Just avoid hard scrubbing or using your teeth as an abrasive cleaning tool. Over time, softer teeth can become thinner and more prone to staining.
Age
is another big factor when it comes to enamel loss. Enamel naturally wears away as we get older, exposing the yellowish dentin beneath and making teeth more susceptible to staining. It's just like fine lines and wrinkles, except for your teeth. As you age, you might notice your pearly whites starting to look a bit more yellow, but there's no need to panic. There are plenty of ways to keep your smile looking bright at any age. So don't let those yellow teeth get you down. There's no fountain of youth for your teeth, but there are some pretty cool things you can do to keep your smile looking bright. Number 2, diet and staining. Now let's talk about diet and staining. What you eat and drink can definitely affect the color of your teeth. Coffee, tea, red wine, and curry can all cause staining because they have dark pigments that stick to the surface of the teeth. Tomato sauce can also cause staining because of its acidity. But don't worry, you don't have to give up these delicious foods. Just be aware that they can cause staining and take some precautions, like drinking through a straw or using a blue light anti-stain toothpaste before indulging in these yummy foods. Now, it's not just the obvious staining culprits that can cause problems. Even healthy foods like berries can stain your teeth because of their high pigment. But that doesn't mean you should avoid berries entirely. Just be aware that they can stain your teeth and take some precautions like eating them with a metal fork so you don't get juice on your teeth. And if you're worried about the acidity of certain foods like citrus fruits or tomatoes, try eating them with a dairy product like yogurt or cheese. The calcium in the dairy can help neutralize the acid and prevent staining, so don't feel like you have to completely avoid these foods. Just be smart about it and enjoy your food with confidence. Number 3, tobacco and vaping. Tobacco and vaping are notorious for discoloring teeth, causing yellowing that traditional brushing can't remove. Chewing tobacco? Dipping tobacco and smoking cigarettes can leave brown stains on your teeth because of the tar and nicotine in these products, and vaping isn't much better. Most e-cigarettes contain nicotine, which can also lead to staining. Long-term tobacco use can result in severe staining and discoloration that penetrates deep into the tooth structure. This type of staining is caused by chemical compounds in the tobacco that bind to the proteins and lipids in your saliva. Over time, these compounds build up on the surface of your teeth, resulting in a yellow or brown discoloration that is very difficult to remove with regular brushing or whitening. Studies have shown that daily brushing with a soft bristle toothbrush and fluoride toothpaste can help reduce staining caused by tobacco use. However, it is important to note that these measures alone may not be enough to prevent significant staining or discoloration. In addition to oral hygiene practices, professional teeth cleaning and whitening procedures may be necessary to maintain good oral health and aesthetics. Number 4, poor brushing technique. Now let's talk about brushing technique. You may think you're brushing well, but if you're not brushing effectively, you'd be missing a lot of surfaces and leaving room for stains to stick around. Skipping the inner surfaces of your teeth is a common mistake that can lead to staining, especially on the tongue side where bacteria tends to accumulate. Also, if you're using a worn brush, it won't be as effective at removing stains and plaque. A new brush should last about 3 months, so consider replacing yours if it's getting frayed. Another issue could be rushing through the process. Brushing should take 2 minutes, but many people only spend half that time. Taking shortcuts like brushing too fast can allow stains to linger, giving your teeth a yellow appearance. Finally, relying solely on brushing without flossing can also contribute to staining. Flossing removes plaque from between your teeth where your toothbrush can't reach, and plaque buildup can lead to stained teeth over time. So if you're brushing but not flossing, that could be the reason why your teeth are still yellow. So make sure you're brushing all tooth surfaces using a new soft bristle brush, taking your time, and don't forget to floss. Number 5, fluorosis or medications. Fluorosis is a condition that causes white spots or streaks on the teeth due to excessive fluoride intake during tooth development. While brushing can help prevent cavities, it won't fix fluorosis. When there's too much fluoride during tooth development, it causes the minerals in your saliva to oversaturate and deposit on the teeth, creating an appearance of white spots or streaks. Although fluorosis is usually harmless, it can be frustrating and embarrassing for those who have it. This happens most often in children under the age of 8 years old. When the permanent tooth is developing under the baby tooth, taking too much fluoride during this critical period can result in the condition. For example, swallowing toothpaste, using fluoride mouth rinse excessively, or having fluoridated water in areas with high fluoride levels can increase the risk of developing fluorosis. But there's good news. Children can prevent fluorosis by brushing their teeth with a precise amount of fluoride toothpaste, using fluoride mouth rinse only as directed, and avoiding the consumption of too much fluoridated water. Certain antibiotics, including tetracycline, can cause teeth discoloration, leading to deep yellow or gray discoloration. Tetracycline is a broad-spectrum antibiotic used to treat various bacterial infections, but its use during tooth development can cause permanent staining. The antibiotic binds to calcium in the developing tooth, causing it to turn yellow or gray. Unfortunately, this staining is intrinsic, meaning it occurs within the tooth structure and is difficult to remove with surface treatments such as whitening. However, there are some options available to help minimize the appearance of staining, including dental bonding, veneers, or crowns. But remember, it's crucial to complete the full course of antibiotics as prescribed by a healthcare professional to avoid complications from bacterial infections. Number 6, genetics and natural tooth color. Now let's talk genetics. You can't change your natural tooth color, and sometimes that color can appear yellow. Some people naturally have yellow or dentin, so whitening may be the only option. You can't always blame staining or discoloration on bad habits like coffee or wine consumption. Sometimes it's just your genes. Your natural tooth color depends on several factors, including the thickness and density of the enamel and the color of the dentin beneath the enamel. People with thinner enamel or a darker shade of dentin are more likely to have yellow teeth. In these cases, professional whitening treatments can help brighten the teeth and improve the overall appearance of the smile. However, it's important to note that teeth whitening won't change the natural color of your teeth. Instead, it will lighten the existing shade by removing surface stains and discoloration. If you have thicker enamel and a lighter shade of dentin, your teeth may already be naturally white. In this case, you may not need any whitening treatments unless there's additional staining or discoloration from external sources. Number 7, dry mouth or low saliva. Saliva plays an essential role in maintaining good oral health and preventing dry mouth. Saliva helps neutralize acids and cleanse the mouth of harmful bacteria, keeping teeth clean and reducing the risk of staining. When you have dry mouth, it can lead to yellow teeth. Without sufficient saliva production, bacteria and stains can stick to the teeth more easily. This can result in a buildup of plaque and tartar, which can contribute to yellow teeth. But there's good news. You can fight back against dry mouth and keep your teeth sparkling clean. One way to manage dry mouth is to stay hydrated by drinking plenty of water throughout the day. You can also use sugar-free gum or candies to stimulate saliva production. Certain foods like citrus fruits and spicy dishes can also help trigger saliva production. Additionally, you can consider using over-the-counter saliva substitutes to keep your mouth moist. These are available in liquid or spray form and can be applied as needed. If you suspect that your medications are contributing to dry mouth, talk to your doctor about possible alternatives. Remember, good oral hygiene practices like brushing and flossing regularly can also help prevent staining and keep your teeth looking their best. Number 8, plaque and tartar buildup. Plaque and tartar buildup can cause yellow teeth even if you brush regularly. Plaque is a biofilm of bacteria that constantly forms on your teeth. Brushing removes plaque, but if it's not removed effectively, it can harden into tartar, which can only be removed by a dental professional. This buildup can stain your teeth, making them appear yellow. If you have plaque and tartar buildup, you may notice that your teeth are more sensitive to hot, cold, or sweet foods and drinks. You may also have bad breath, red or swollen gums, or notice changes in your bite. All right, now that you know the top reasons why your teeth might be yellow, even after brushing, it's time to take action. Remember, brushing is essential, but it's only part of the story. If you want truly white teeth, you have to address the deeper causes. Start by being mindful of the foods and drinks that can cause staining and take steps to prevent it. Don't smoke or vape, as this can cause long-term yellowing that brushing can't remove. And don't forget to floss. It's just as important as brushing and can help remove plaque from between your teeth where your toothbrush cut into reach. If you're concerned about the color of your teeth, schedule a consultation with your dentist. They can determine if whitening is right for you and advise you on other options like veneers or crowns. Don't let yellow teeth hold you back. Take control of the situation and invest in your oral health today. Thanks for watching. What surprised you most? Drop a comment and let's talk teeth. If you've been brushing faithfully, give this video a thumbs up. You deserve it. Hit that subscribe button for more dental truth bombs and eye-opening health facts. Now watch this. Charcoal toothpaste. Whitening savior or scam?